All right, good morning, everyone. I know folks are just starting to log on. Welcome. We are down to our final 2 weeks of our Cardi-OH clinic, weight management and behavior change cases and discussions. I will just show our usual contact info. Of course, as you're logging on, please be sure to chat your name and your practice name into the chat feature. This just helps us record attendance. And I think we'll go ahead and get started. I've got some reminders at the end, but we'll go ahead and dive into the agenda. So Dr. Rao, you can take it from here.
Thank you, Jesse. Thanks to everyone for making it this far. We're almost done through this series, and I hope it's been enjoyable and educational. So we have a great presentation by Drs. Beverly and Taylor. And before we get to that, we have a couple of great cases as well. I just want to say that this particular presentation is about collaboration and partnerships. And I did serve on the National Academy of Medicine's Obesity Education Committee. And this was a huge emphasis of that committee's work, essentially because as primary care providers, whether they're physicians or APPs or any other healthcare professional, we realize we cannot do this ourselves, if only due to time constraints, but also due to a lack of expertise. And sometimes partnerships are the way to go. So the dream is that you're working with a dietitian in the community who says, look, I'm working with your patient, and I, as a physician, I'm responsible for changing perhaps their diabetes care. And there's a ongoing communication between both of us, and we deliver the same message to the patient, so it's reinforced multiple times. So with that introduction, Liz, I think you can start. Please take it away.
Hello, everyone. So I will be starting it off and then passing it off to Dr. Taylor. Next slide. So our objectives for this session are to describe the importance of partnerships in influencing body weight within communities, list a minimum of 3 organizations who can partner with healthcare professionals to influence body weight within communities, and to describe the process of establishing a new partnership to influence body weight among patients. Next slide. So I'm briefly going to talk about the importance of community partnerships. So throughout this series, all of you have made it very clear, and we've talked about it, that healthcare providers see the physical, the emotional, and the social complications of body weight. And for the most part, we've talked about how your patients want to make healthy choices. However, sometimes those choices are not necessarily available based off of their life circumstances, or they may not be available in the community that they live in. And we're going to talk about the context of the community now, such that the community can have a really profound effect on the food that people are eating. So some of the things that we've talked about, we've referred to social determinants of health, but lack of public transportation to get places, certain areas, particularly in rural areas, there might be lack of a full service grocery store. You can see this in certain urban areas as well as in rural areas. There are higher costs for fresh produce perhaps, and lower costs for unhealthy foods. Next slide. So I wanted to put this model in here. So this is an adapted model. It's the socio-ecological model of childhood overweight. And this was actually created by Kirsten Davidson and Leanne Birch when they were at Penn State. And I actually had the opportunity to work with them when I was an undergrad a very long time ago. And so I think that this model kind of sums up all of the different factors that can affect a child's weight status, but we can take this and apply it to anyone for the most part at any age. And so you can see some of the individual characteristics that someone cannot change, for example, their gender, their age. And then you can look at some of the family context as well as the community. And so while we might be able to replace school lunch programs with whether or not there are work programs within where someone works or in the community, this is very important to just look at all the different things that can have an effect on someone's body weight. Next slide. So what we need to know is, seeing all those things that influence an individual, what we need to do is find a way to increase access to programs that can help facilitate eating healthier foods, as well as opportunities for physical activity, stress reduction, promoting coping, and all of these healthy behaviors. And so one of the ways, and this is what Dr. Rao just mentioned, is focusing on community partnerships. So healthcare providers can promote positive change by partnering with community organizations, and this is nothing new. And Dr. Taylor is going to talk about some of those specific partnerships. So we know that communities can have a very profound impact on the food that people are eating. Next slide. So what is the value? Well, the value of having a partnership as a healthcare provider, I know it's one more thing added to the plate of all the work that you have to do, but more can be done than as an individual. You can actually share the roles and responsibilities if you have that partnership. You don't need to know everything about that issue that you're addressing because you're working as a team and you can share your shared knowledge, and you can also learn from one another while you're doing this. So there's a lot to be gained by partnering with community organizations for a shared goal. Next slide. And so now I'm going to pass it over to Dr. Taylor.
Great, thank you, Dr. Beverly. And a lot of what I wanted to do with the content that we've talked about is tie this back to a lot of the case discussions that we've had. How do we utilize, what are the challenges that we've seen? What are the opportunities that we have? What are the community partnerships are really looking at ways of how do we make connections with people that are outside of our office or outside of our specific network and help get individuals to the resources that they need. And a lot of the conversations that I've had with some of my colleagues have been around, well, I don't really know what's out there and I don't really know what we can use. I know that there's a problem that we need to bridge the gap, but I don't really know who's eligible and what programs exist. So the first element that I really wanted to think about is if we're talking about weight management, we want to start talking about eating well and looking at these long-term outcomes. Individuals have to meet their primal needs before they can even make the next step to trying to make healthier lifestyle changes. If it's a decision between my rent, my car payment, and food and medicine, it makes it much harder for us to make healthy lifestyle decisions to bring down my diabetes or to help manage my weight. So the first step in some of these just might be meeting individuals' primal needs through assistance programs. And Ohio, and as well as various federal programs, really help individuals with, we have everything from energy assistance programs that will help with heating and cooling. We live in Ohio, which means probably need both of those in the same day or in the same week. But the actual energy costs, and especially now with current rising energy costs, it drains on the monthly budget. And for individuals who are on restricted income, the increased cost of food and now the increased cost of fuel are in direct competition. Food assistance programs are another one. I wanted to just list a few, and we have direct information on the Ohio Department of Health's website that will actually target towards these, but the Supplemental Nutrition Assistance Program basically provides food voucher through an electronic benefits card for individuals that are below 130% of the federal poverty rate. And that's there's no set dollar value for that because it depends on the number of people in the household. And then the Women, Infants, and Children program will help benefit individuals who are less than 105% or 185% of the federal poverty rate and show nutritional risk. So this will happen for households with a pregnant woman or for children who are under 5 years of age. Because the assumption is after 5 years of age, they will transition into the school meals program. But when school ends during the summer, you end up with that gap. So there are summer feeding programs, summer food service programs that provide some of that food for the children that can help increase resources within the household. And then food pantries and senior farmers markets are other places where we can help connect individuals to food that is outside. I know we're starting to see some practices where individuals patients are being asked, have you had troubles accessing food in the last 30 days? And now it's how can we then develop this list of resources in the community? What's the eligibility? Where do you go to get the information that if we can compile that and we have individuals that have these limited resources, then we have a quick, readily available piece of information that we can pass along. And instead of saying, I think you might be able to get SNAP, but I'm not really sure how you can go or where you have to go or what the website is. If we can compile this information, it helps them meet those primal needs. Again, we're aware of unemployment assistance. There's also the availability for childcare assistance. So thinking outside of the box beyond what our medical problems may be and starting to think about what are the issues that might be in the back end that will become barriers for them to be able to get themselves activated, get them have the resources that they need to purchase healthy food and make those decisions. On the other side is how do we then link individuals to resources within the community that can help foster their behavior change, help gain access, give them the support that they need while they're trying to make behavior changes that we may be promoting. So there's a lot of educational programming that happens within the community. I know we've had a handful that have come up as part of our discussions of the cases throughout, but the SNAP education program or SNAP Ed, commonly known, comes out through cooperative extension to provide nutrition education in the community. The diabetes prevention program exists within the community itself, and a lot of kind of grassroots community weight management programs and education programs that come from either local health departments or local health organizations, as well as linking individuals for support groups. We've had that discussion around Overeaters Anonymous and getting individuals into these support groups, which may be through social media platforms, they may be through local organizations. But identifying what those resources are within the community so that we can create that gateway of when somebody has a concern, we now have the information that we can pass forward. And referral services, being able to identify if there are places within the community that are kind of good patrons that within one of the local food pantries within the community here in Central Ohio, they function as a food pantry, but they also kind of function as a network that then helps them refer them to Job and Family Services if they need unemployment support, or to the SNAP program or to the WIC program. So finding those hub sites that can then help, if you know you can get them to the one place that then can help get them to all the other resources, it can be extremely valuable to the patient. And also the retail partnerships that exist. From my perspective and the work that I've done, we've had a lot of collaborations with different grocery stores and the types of education that they'll do, either taste testing or grocery store tours, direct education type, kind of aisle-based education where they can walk down the aisles and look at food labels. So what types of partnerships within those that they're, because what they want to do is become the place where people know, people are comfortable going to get food, can understand that, and they're building a client base while they're also helping us address their health needs. So next slide, please. So I put a link to a report that was released not too long ago, and it was about building community health partnerships, and it's kind of a toolkit that was between the National Business Health or the Business Coalition on Health and Community Coalitions for Health Institute. So a lot of different partners coming together for this. And I like this report for a reason, because it creates a foundation that helps bridge that medical model of treating and business model and health community together into one, and really help facilitating getting people together over very different language. When we're making partnerships with businesses, one of the primary endpoints that they're going to be looking for is either their bottom line or product loyalty, or however. Those aren't going to be the same kinds of conversations that we're coming at where we're trying to get people to eat healthier foods or be more active. So being able to come together on a common goal and making it a win-win situation, or in this case, a win-win-win situation across the spectrum, makes these partnerships more valuable. Next slide, please. Sorry. So some of the key steps in building these partnerships, and kind of a 4-step process and working forward, is first the networking and sharing of what are people in the community currently doing. And sometimes that's one of the hardest parts, is you know that there are some resources that are happening for support groups, you know there's some education happening, but how do we gather this information together, connect around these particular areas, and identify who these potential partners might be. Once we've identified who the partners are and who we can get buy-in that are interested in this shared common goal, then how can we share the information about what we're doing? What are our current challenges? Where are our gaps? And then that allows us to move on to a cooperating step where we can start to identify, these are the gaps that we have, and then how do we build mutually beneficial strategies that these individuals need education, but we have trouble reaching the individuals that within the community. So now the medical system can become a pathway to help these communities reach the individuals that they're trying to serve. And the community becomes a provider for the medical management team when there's more that the patient needs to be able to make the strides that they really want them to do. So now they become the networker, the collaborator, and the cheerleader to get them to the services. And then finally, what ends up being sometimes one of the most challenging ones is the collaboration. It's the creating the mutually beneficial strategies, determining what the outcomes are that we're truly looking for, and in creating the team that really allows us to share that turf, to create communication across the groups. Now we understand that the education is happening here, and now that education can be passed back to the provider who is within the healthcare team and trying to manage a patient's health based on all of the other factors that are outside the realm of what happens inside the office walls. So if we're able to build those collaborations, build those strategies, and make those connections, now we can make it easier for the work that we're trying to do to promote health, and do it within the context of and the concept of the whole patient-centered medical neighborhood. It's everything outside in the world, outside the doors of the medical office, that have an influence on the patient's health. So with that, I will stop and we will take questions.
Thank you, Chris. Any questions for either Dr. Beverly or Taylor about this? You know, it's interesting. My patients with diabetes spend 20 minutes with me every 3 months if they make it in for an appointment, but the rest of their time is spent in the community. So I think we ought to pay a little bit more attention to it. Okay, thank you. Any questions, comments? If not, let's turn things back to Jessie for a moment, who has some announcements as well.
Sure, thanks everyone. So I mentioned this last week. I just wanted to note again, the next cardio webinar will be on remote monitoring for diabetes, embracing technology to improve patient care. Registration is now open for this, so you can access that link or visit our website to learn more about it. And then as per usual, you'll have your post-clinic survey in your inbox. That's feedback for this morning's session, but you will have received a second email from me, which is what we title Final Clinic Feedback Survey. So next week is our wrap-up session. We typically take your comments or questions or any areas of interest that you'd like to discuss next week. So please feel free to type those in, and we'll try our best to sort of tailor the didactic presentation to your comments. And then lastly, I just wanted to note that we are confirming details for our upcoming clinic. So I'll have more info for you for our fall series next week. And those are my announcements. So I think we're all set. I hope everyone has a great rest of their day, and we'll see you next Thursday.
Thank you, Jesse. So our final wrap-up session, really, we've used to discuss items that we forgot or we just didn't address for whatever reason. So please make sure to respond to some feedback, and collectively as a team, we'll do our best to answer your questions. Have a great week, everyone. Thank you. Bye-bye.